Good morning, everyone. My name is Anna Fall. I'm the Executive Director at Traeger Institute, and it's my pleasure again to welcome you all to our weekly coronavirus virtual information session. We're very happy that you are able to join us again. I just want to remind everyone to keep your microphones on mute if at all possible. And let's go to the next slide, Justin. Okay, while we're waiting for Justin, let me ask you all if you can do me a favor and type in the chat what county you are representing. That will help us tremendously to know where you come from, just to see where the outreach is going. So if you do not want your face to be recorded, you should keep your video off. Otherwise, it doesn't matter. It's totally fine. Ask your questions in the chat as much as possible. It seems to create a better flow. And then there's a number you can call if you are concerned about your health and you need to get tested. Let's go to the next slide, Justin. Okay. All right, there seems to be a little bit of a lag, but I think I have said basically what I need. Oh yeah, the sound question. I just want to say if you have difficulty with your sound, click on the arrow next to the microphone to test your system. Everything should be working. And if you want to speak, make sure you unmute yourself. And with that, I already asked everyone to put in their counties. And I am now going to introduce you to the speaker of today. Her name is Tara Sharpmeyer. She earned her PhD in social work from the University of Louisville. She serves on the faculty of the University of Louisville School of Medicine and the Kent School of Social Work. Her research interests include psychosocial care of cancer survivors and their family, gerontology, palliative care, survivorship, and interprofessional education. And today she's going to talk to us a little bit about grief and loss in the time of COVID-19. So thank you, Tara, for being here, and I'm giving it over to you now. You're on mute, Tara.
Okay, hi everyone. Sorry about that. I'm discovering that while trying to advance slides, that there is a lag. I'm not sure why, but bear with us while we figure this out. Thank you, Dr. Fall and Dr. Furman, and to the Institute for having me today to talk about this important topic. This is certainly something we're all facing right now. And it's important for me just to acknowledge right up front the work of the many grief experts who have put out blog posts and interviews recently that really have put a lot of time into developing content regarding grief in the time of the coronavirus. And those people are David Kessler, Kenneth Doka, and Robert Niemeyer. And this really is drawn upon their brilliant work. So thank you to them. And I'm still trying to advance. Let's see here. Okay. I think I found the secret. So hopefully it'll work from now on. So first and foremost, it's important that we need to acknowledge that we're facing a different time right now. All the things that we consider normal are no longer so. And doing so really helps us manage our expectations of ourselves and others. Living during the COVID-19 pandemic has changed so much of how our society functions, including how we care for the sick, how we care for the dying, and how we care for the bereaved, with our sense of control challenged at all times. Routines and rituals that normally bring comfort aren't readily accessible, which can increase feelings of isolation and loss. We must also understand the nature of grief. This is important as grief is far more complex than most people think. First and foremost, it's important to think about what grief is. Have you ever actually thought about the definition of grief? Perhaps you've only associated it with mourning the death of a loved one, perhaps. Actually, grief is a complex biopsychosocial and spiritual response to any real or perceived loss. Notice the word death is not in there. It's actually a response that we have to any real or perceived loss. So this is an important distinction here because the loss does not have to be real. And grief typically follows a wave-like pattern that tends to ease over time as people adapt to their changed circumstances and regain a sense of control in their lives, something all of us are missing right now. We're certainly all facing many real and perceived losses these days due to our physical separation from one another and the disruption in daily routines, our inability to celebrate and worship together, and even in seeking healthcare for non-COVID related issues. Caring for our loved ones, including our inability to visit them in the hospitals and nursing homes, the financial toll this virus has taken on us, and the sickness and death that it has caused. With that said, I think we all can acknowledge that we are all grieving right now. We're feeling a number of different griefs. We feel the world has changed, and it has. We know this is temporary, but it doesn't feel that way. And we realize things will be different. Just as going to the airport is forever different from how it was before 9/11, things will change, and this is the point at which they changed. The loss of normalcy, the fear of economic toll, the loss of connection, this is hitting us, and we're grieving collectively. We are not used to this kind of collective grief in the air. We're also feeling something called anticipatory grief. Anticipatory grief is that feeling that we get when the future holds, get about what the future holds when we're uncertain. Usually it centers on death. We feel it when someone gets a dire diagnosis or when we have a normal thought that we'll lose our loved one someday. Anticipatory grief is also more broadly imagined futures. For example, we might be thinking there's a storm coming or there's something bad out there. With the virus, this kind of grief is so confusing for people. Our primitive mind knows something bad is happening, but we can't see it. This breaks our sense of safety. We're feeling that loss of safety. We've not collectively lost our sense of general safety like this in decades. Individually or smaller groups, people have felt this, but altogether, this is a new feeling. We are grieving on a micro and a macro level. Grief also brings us other feelings. There's anger. You might be thinking, you're making me stay home and taking away my activities. There's bargaining. Okay, so if I social distance for 2 weeks, everything will be better, right? There's sadness. You might be thinking, I don't know how this will end. And there's acceptance. You might be thinking, this is happening and I have to figure out how to proceed. Acceptance, as you might imagine, is where the power lies. We find control in acceptance. For example, I can wash my hands and I can keep a safe distance. I can learn how to connect with people virtually. Unhealthy anticipatory grief is anxiety. Our minds begin to show us images of things like our loved ones getting sick. We see worst case scenarios. This is our minds being protective. Our goal is not to ignore those images or to try to make them go away. Your mind won't let you do that, and it can be painful to try to force it. Our goal really should be to find balance in the things that you're thinking. If you feel the worst image taking shape, make yourself think of the best image, imagining that we all get a little sick and the world continues, imagining that not everyone we love dies, and maybe no one does because we're all taking the right steps. Neither scenario should be ignored, but neither should dominate either. Anticipatory grief is the mind going into the future and imagining the worst. To calm yourself, you might want to come into the present. This will be familiar advice to anyone who has meditated or practiced mindfulness, but people are always surprised at how easy this can be. When you feel your anxiety and imagine fears taking hold, you can start by just naming 5 things in the room around you. There's a computer, there's a chair, there's a picture of a dog, an old rug, a coffee mug. It's that simple. Breathe. Realize that in the present moment, nothing you've anticipated has happened. In this moment, you're okay. You have food. You are not sick. Use your senses and think about what they feel. The desk is hard. The blanket is soft. I can feel the breath coming into my nose. This really will work to help dampen some of the pain and anxiety. You can also think about how to let go of what you can't control. Your neighbor is doing, what your neighbor is doing is out of your control. But what you can control is staying 6 feet away from them and washing your hands. And you can focus on that. It's also a good time to stock up on compassion. Everyone will have different levels of fear and grief, and it manifests in different ways. When our loved ones get snippy with us, we can think to ourselves, that's not like this person. That's how they're dealing with this. I'm seeing their fear and anxiety right now. So be patient and think about who someone usually is and not who they seem to be in this moment. Another troubling aspect of life as we know it these days is when someone is hospitalized or placed in a nursing home or even dying in the hospital and we can't visit them. This is not at all how we ever imagined supporting our loved ones when they are ill or dying. One thing you can do is call and ask for the social worker or the chaplain for the unit where your loved one is. These individuals are working very hard right now with nurses and doctors to create virtual connection, share messages, and dictate notes back and forth. And funerals are another area where we normally grieve publicly together over the death of a loved one. Funerals really are for the living. We realize that now more than ever. They're an occasion for a community to recognize the loss and gather support for those who remain. But the novel coronavirus pandemic has disrupted these much needed mourning rituals. To slow the spread of COVID-19, the CDC has really discouraged events of more than 10 people, and this guideline has extended from the Irish wake to the Jewish Shiva. It's also created thousands of new mourners, many of whom are grieving alone. In response, funerals and memorials have now begun live streaming as a short-term solution for ongoing grief. You've even probably heard about some drive-by opportunities. And these are important to do now, again, for short-term solution, but eventually every mourner needs the human touch. And it's important to recognize that when the crisis passes, these rituals can still take place. In the meantime, continue to adapt rituals. You can still honor your loved ones in different ways. You can plan a virtual celebration of life where friends and family members can come together to share pictures and reminisce. Consider writing your loved one a letter or leaving them a voicemail. You can tell them how you feel, especially if you were unable to say a proper goodbye. You can make a playlist of their favorite music and share it with others in their memory. You can also plan for post-COVID-19. Making plans helps us feel in more control. Make a to-do list of tasks that you will need to complete when the COVID-related restrictions ease, and plan a memorial event or service for your loved one if you weren't able to. Consider attending a support group even for bereaved families who were impacted by COVID-19. If you have unanswered questions about for your loved one's medical team, you might want to write them down now and consider contacting the team at a later date to arrange a meeting. And remember, there are many other rituals and celebrations that we've lost temporarily, from births, weddings, to graduations. These too can be adjusted for now, knowing that when this crisis passes, new rituals can take place. And grief is isolating and lonely to begin with, and to have to be quarantined is making it a lot harder. Death reminds us that our sense of control over the world is an illusion, a realization that can be very disorienting. And this pandemic has only exacerbated this sensation. Without support, people may suffer more than they normally would under normal circumstances. Grief is definitely not a mental health issue, but if it's not addressed, it can become one. There's actually little research on the experience of grief in isolation, but one concern is that people mourning alone will be more likely to experience anxiety, depression, and complicated grief, which is when people struggle to integrate their loss into their identity. The condition, which affects about 7% of mourners, can manifest in troubling thoughts and behaviors, like the belief that their loved one may come back or that their life is now meaningless. Complicated grief can and does occur even when we have a robust support network. But without the recognition and reinforcement of others, people may struggle even more to adapt to their new normal. The consequences of seclusion can have other effects too. In one study of over 200 older adults who experienced the loss of a partner, social isolation was associated with longer lasting grief and worse mental and physical health. So we know that this can be real. And while mourning alone is a unique challenge, there are ways for people to address their grief in isolation. Some of them I've already talked about. I'm going to go through some more here for you now. It's important starting to reach out for support. Staying connected to your family and friends is especially important right now. Connect daily, using technology with your family and friends, even if you don't feel like it. And though nothing can replicate an in-person interaction, having someone to check in through text messages or phone calls on a regular basis is essential to maintaining a connection with the outside world. Call your doctor's office and schedule a virtual visit, or arrange a call with someone from your spiritual or religious group. Consider joining an online support group. Hospice of Louisville, for example, is offering many online bereavement support groups right now. You can make a virtual appointment with a grief counselor, especially if you feel overwhelmed or have little support. You can call a national hotline. Online support may offer some people a path forward, provided the person grieving has basic tools like Wi-Fi, a computer, and a video camera, but not all sites are equal. It's important to get connected with reputable sources like the Traeger Institute website. For people who are grieving alone, a meditation or visualization practice is important for addressing anger and anxiety that comes with grief. Even if you don't have a professional guiding you, dozens of apps, such as Calm or Headspace, offer these services. People may find meaning in journaling, altar building, and private rituals, and even when public rituals like funerals are off limits. And participating in calls like these is a huge step in your self-care. Creating a daily routine is also important. When grief is new, routines can provide a sense of structure to your day, especially during uncertain times like these. Try to wake up and get out of bed at the same time each day. Eat at regular meal times if you can. Plan your day in chunks of time, including meals, exercise, tasks related to your loved one's needs, work, or connecting online with family and friends. Make a daily to-do list and check off the items as you complete them, such as attending to administrative or home-related tasks. And carve out time to grieve. Being sad is normal when you're grieving, and it's important to give yourself permission to do so and to acknowledge the other emotions that you might be experiencing. Focus on self-care. This is always recommended, especially given the stressful nature of grief during these times. Practice increased hygiene, especially with hand washing and soap. Try to eat, even if you don't feel like it. Where and when possible, avoid processed foods. Limit your alcohol intake, and exercise daily. Consider an online exercise or yoga class. Try one of the online meditation apps I've already mentioned, and keep a journal of your thoughts and feelings and list any questions that you have. And certainly limiting your media exposure during these days can definitely be helpful. Now challenge your thinking. Remember that how and what we think affects how we feel and what we do. That's a really important statement, so I'm going to say it again. How and what we think affects how we feel and what we do. In very stressful situations where we don't have a lot of control, our thinking can often make us feel more distressed and upset. If you are aware that you are feeling increasingly strong emotions related to the things that you are grieving, such as guilt, anger, or distress, ask yourself, what am I thinking? What am I telling myself about what happened? It can be easy to blame yourself, even when there is no evidence for doing so. To challenge your thinking, ask yourself, how would I advise a friend in the same situation? What would my loved one say to me if they were right here with me now? It often helps to write down your thoughts and your answers to the questions above and try to stick to the facts. It's also helpful to remind ourselves and others that we are in a pandemic that has caught the entire world by surprise. Difficult decisions had to be made for the health of our society as a whole, which were beyond the control of any individual. One particularly troubling aspect of this pandemic is the open-endedness of it. This is a temporary state, and it helps to say that out loud. This is a temporary state. I've worked with people affected by cancer for over 20 years, and I've seen people's worst fears come to pass, and I saw people find strength and resilience to live beyond the illnesses that plagued them. The precautions we're taking now are the right ones. History tells us that. This is survivable, and we will survive. This is a time to overprotect, but not overreact. We can take this opportunity to find meaning in things that we hadn't noticed before. Even now, people are realizing they can connect through technology. They are not as remote as they thought. They are realizing that they can use their phones for long conversations. They're appreciating walks. I believe that we will continue to find meaning now and when this is over. And if you're still feeling down, keep trying. Give yourself permission to grieve. There is something powerful about naming this as grief. It helps us feel what's inside of us. So many have told me in the past week, I'm telling my coworkers I'm having a hard time, or I cried last night. When you name it, you feel it and it moves through you. Emotions need motion. It's important to acknowledge what we're going through. One unfortunate byproduct of the self-help movement is that we're reminded to have feelings about our feelings. We tell ourselves things like, I feel sad, but I shouldn't feel that. Other people have it worse. We can and we should stop at the first feeling. I feel sad. Let me go for 5 minutes and just feel sad. Your work is to feel your sadness and your fear and your anger, whether or not someone else is feeling something. Fighting it doesn't help because your body is producing that feeling. If we allow the feelings to happen, they'll happen in a way that empowers us, and then we're not victims. And that's it. Thank you very much.
Thank you, Tara, for that lovely presentation. I am going to ask anyone that have a question to Tara to type it in the chat, because I'm now going to give the opportunity for Dr. Furman to give a quick update on where we are on the coronavirus. And then also a reminder, if you haven't typed in your county yet for where you are from, please do that for us in the chat. Thank you, Tara. Now it's over to Christian.
Yeah, Tara, that was really, really good. I think it's helpful just to kind of pause and really take what you said to heart. So thank you so much. That was good. So I just want to kind of give an update. A lot of this comes from the, Governor Beshear has a daily update at 5. But yesterday there was his update was 102 new cases in the state and 56 were in Jefferson County. So the total cases in Kentucky are 3,050. There were 6 deaths on Monday, and so there's 154 total deaths throughout the state. So since it was over the 150 mark, the governor today, they're having a wreath laying ceremony at the Capitol, and they're going to videotape that and show that at 5 today as part of the daily update. But the good news is that, originally they thought the surge was going to come like May 4th to 5th. And now they're thinking the surge is going to come maybe even later this week. But the models keep changing, and it's because, no one really, it was all a mathematical model. There's like different models. And so they're kind of putting all these models together. And the big thing is that we have flattened the curve in Kentucky because people are washing their hands and following social distancing and doing all the right things. And so these models didn't take into account people doing the right thing. So I think it's great that we're all, doing our part. And so it sounds like the surge is not going to be as big of a surge, really. It's just going to be continuing as is. So the big thing is that, we are wearing universal masks now. We do recommend masks when you go to the grocery store. You can use the homemade mask. The big thing is that it needs to cover your mouth and your nose. And if you touch your mask, you need to wash your hands. And so people do touch the mask a lot. So you just have to wash your hands a lot. Don't put it down around your neck, because then that defeats the purpose. And you should wear a mask is if you cannot be 6 feet away from people. If you're 6 feet away from people, you don't have to wear a mask. But if you're going to be out and about, and the problem is you don't know who's going to just walk up to you. I had somebody touch me the other day and I just about flinched. I was like, why are you touching me? So you just never know when you're going out and about. So the best thing is to stay at home and not go out and about, but sometimes you have to go to the grocery store. And so I would recommend wearing a mask in the grocery store. I also want to talk about the antibody testing. Some people have had COVID and recovered. And so, you do have the antibodies, and it's not readily available, this antibody testing, but they are doing it in the hospital. And the UofL does have a program where people are donating their plasma if they've had COVID to see if it'll help other people. So this is all research going on, but UofL is partnering with, our own institutes to do that research. So if you're interested in that, it's on the UofL's website. we don't have it in our clinic, and most clinics don't have that. It's more of a research at this point. I'm serving on the governor's long-term care task force, along with one of our other faculty, Laura Morton, and that task force is today going to release our recommendations for long-term care facilities, personal care facilities, assisted living, high rises. So look for that. And I think, you know, it's always a work in progress. We might have to modify it after we release it, but at least we're going to get it out there and trying just to keep everybody healthy and safe in those facilities. The governor also announced that the elementary, middle school, and high schools are going to, throughout the state, are going to be closed for the rest of the year to in-person teaching. It's all going to be, you know, online teaching. So that's a big issue because, you know, everybody, not everybody, but a lot of people have kids, and then that's, you know, your child care, like, you know, you have to be home with your kids during the day. So there is this, you know, talk about when UofL Health is going to reopen. UofL Health is trying to look at a June 1st date to start maybe doing elective procedures again and starting to think about that. But, you know, it's every day changes. You say something one day and it changes the next. So that's just what they're looking at. That's nothing hard and fast. And it looks like the main campus, UofL, and main UofL is looking at maybe June 30th as a reopen date. So that's always, like I said, it's a work in progress. It changes, but I think, you know, some states are starting to reopen and thinking about how to reopen. And the big thing to reopen is that you have to have 2 weeks of the numbers going down. And so we don't have that right now in Kentucky. Also, you have to have enough testing, and we are having testing around the state more. So we are getting to that point, and you have to have enough personal protective equipment. And it sounds like, you know, we're getting there where we're starting to have enough personal protective equipment. We're making more. So I think we're getting to a point. So I think you're right, you know, Tara, to say like this is temporary. At some point we are going to get back, but it is going to be a new normal. I think, you know, it's not going to be just totally back the way it was before. Kind of like you said, Tara, with the airports, you know, after 9/11, it's a new kind of airport. So it's going to be a new kind of thing. We just don't know exactly what it's going to look like. And the big thing is, we talked about this yesterday on a KCHC meeting about, you know, wearing gloves. And the thing is with wearing gloves and masks, you have to know the proper technique, you know, so when you put on the gloves, then if you just keep touching everything, it's the same thing as like not wearing gloves. So if you're going to wear gloves, you almost have to, you know, take them off before you touch something else. So, and when you take off the gloves, you need to turn them inside out. So, and then just throw them directly away. So wearing gloves sometimes it gives people a false sense of security, because then with the glove, then they'll touch their face, you know, so it's the same thing. So the big thing is don't touch your face. And if you know, with dirty hands, and, you know, not dirty, but you don't know, you just have to kind of think that everybody has the virus. So you just need to wash your hands every time you touch something. Every time you touch the mail, you want to wash your hands. When you touch your groceries, you want to wash your hands. And then I just wanted to say that I think you mentioned this, Tar, that, you know, one way to connect even with your providers is through telemedicine and telehealth. And so we are doing telehealth with our Traeger Institute and Optimal Aging Clinic, and it's going really well. It's like doing a home visit. You know, yesterday I had a patient and I could have her go get her medicine and look at the bottle and see the milligrams. And so a lot of times in the clinic, people forget their medicines. They don't know what they're taking. So it's really helpful that you can see the bottles. I could see her pictures on the wall, and could see her whole family. And so it gives us a connection that we didn't have before. It's the gold standard in geriatrics is doing a home visit. So it's been fun to do telehealth. So please, you know, call us if you need. We're doing new patients via telehealth. We're doing counseling via telehealth. And we're seeing, you know, follow-ups through telehealth. So that's some of my updates, and I'm happy to answer questions. And Tara, I know, is happy to answer questions. I don't know, Dr. Fall, is there other parts of these?
No, that's good. Thank you. Thank you. I had one private question that was directed to me. It was actually supposed to be to the chat. So I'm going to ask that to you, and then Justin can continue the rest of the questions. The question is, what do you think it will look like when we lift the quarantine? What will our daily activities look like?
Well, I think people, I mean, you know, it's going to be, until we get a vaccine, I think, and until we get herd immunity. So a vaccine, you know, would be everybody gets a vaccine so you don't get the virus. herd immunity is kind of like now with the flu shot. You want pretty much everybody to get the flu shot, but some people just don't get the flu shot, or some people can't get the flu shot because they're so immunocompromised. So if pretty much most people get the flu shot, then like no one gets the flu. So that's the herd immunity, is pretty much, once enough people get immune to the virus, then pretty much everyone's immune to the virus. So until we get that, which will probably be a year, I think we are going to be, people have to be 6 feet apart. People have, if you're going to be more than 6 feet apart, you have to wear a mask. So I think that's what it's going to look like. I don't think anybody really knows, but that's what I'm hearing, and that's what it seems like. Does that answer the question?
Yeah.
Okay.
Justin, are you asking the rest of the questions?
Yes, I can ask the rest of the questions. I can't answer them. So Dr. Furman, if someone tested negative, but their doctor believes that it had been a false negative based on symptoms, will they be able to get an antibody test?
Right, and that's a good point, that you can test negative and still have COVID. COVID is a clinical diagnosis. So if you have the fever, cough, shortness of breath, diarrhea, sore throat, mental status changes in older people. If you think it's COVID, then you have to treat it as COVID, even if the test it comes back negative. But yes, I think the antibody test, the antibody test is a blood test. So, I think some people are doing finger stick and some people are, drawing the blood out of your arm. But that's really available right now in the hospitals. So, we want to get just a regular nasal swabs. Right now, it's the nasal pharyngeal swab that goes into your nose that tests for COVID. And we don't even have enough of those tests right now. So I think, eventually I think the antibody test will be in every doctor's office, but we just don't have it right now. So right now, if people want to be part of that research where they get their antibodies tested and they donate their plasma, it's through UofL. UofL Health has that information on their website, and the UofL School of Medicine has that information for the research.
Will there be separate restrictions for skilled care versus higher functioning assisted living populations, and also for the ability to see their loved ones to decrease behaviors and agitation with their cognitive impairment?
Yeah, that's from Joy Tabler. So Joy, I think you're right. These different levels of care, but I think it makes a big difference in what level of care. The guidelines that the Long-Term Care Task Force put out was one guidelines for skilled nursing and then one guidelines for everything else. And the guidelines was really about when to send people to the hospital and when do people get out of the hospital and go to these skilled places. The big difference is skilled nursing, has nurses, they can give medicines, they have oxygen, but everything else, there's really no oxygen in the building. And so there are going to be different guidelines for both of them. But I know what you're talking about, the ability for dementia populations to see their loved ones and all that. We haven't gotten there yet with this task force. I think, we're just dealing with the crisis and the people in the hospital right now. Right now, it's still where all these facilities are on lockdown and they're not letting people come in, because that is really, once it gets into a building, it kind of spreads like wildfire. And so we really don't want COVID in any of these buildings. And the people that bring it in are the loved ones, are the healthcare workers. And so we have to be really careful with that. So I think at some point, that will get better. But right now, if loved ones want to visit the person with dementia, they're recommending like the window visits, keep the window closed, at technology visits through Zoom or FaceTime. But you're right, the behavior and the dementia patients are just having a hard time because they're not having their regular routine, and you want their regular routine. Like, Dr. Shatmeyer said, routine really does help, and it really does help these dementia patients too.
And so Joanne with Bluebird Home Care chimes in. They're still providing essential care services for clients and going into facilities that are allowing it. Each facility has different restrictions, but their caregivers are wearing masks and gloves and have been trained to use them properly.
Yeah, it's really helpful. I know Home Health is going out to the home still, and Home Health has the N95 mask, and then this Bluebird Home Care. Yeah, so I mean, it really is. And you're right. Each facility has a little bit different way they interpret the rules and who they let in and who they don't let in.
So will the governor said that healthcare would be the first group of businesses to see loosening of restrictions, restoration of routine and elective procedures, and I see June 1st as a tentative date. Will they give written guidelines for safe operating procedures to healthcare providers, and will PPE be provided to them at the level their clinic requires?
Yeah, I think that's the thing, is the governor is trying to, figure out now how to have policies to reopen and to reopen kind of one thing at a time. So I think they really are talking about having these elective procedures start to take place. And I'm just looking at what you said again, June 1st, they give written guidelines. Yeah, I think there are going to be written guidelines. It's going to be very specific. And the PPE, yes, there is a lot more PPE than there was originally. And so they are, there is that, I think last week we talked about there's this PPE website to get PPE. And so they're having a better handle on where the PPE is and who needs it and how to distribute it. So yeah, I think there'll be really a lot of detail about that. And so that they're not going to really reopen until they have all that worked out.
So Dr. Schappmeyer, can you give some examples of things people may not consider as a loss, but really is a loss during this crisis?
Certainly, I named several obviously in the presentation, but remember, these are real or perceived losses that we're grieving. So some examples include, anticipating the future as you anticipated it, maybe you, in physical touch, that's another example. Many of us are not touching each other as much as we were, as Dr. Furman indicated, and even our loved ones. Even my husband the other day, I noticed he was a little bit hesitant to hug me, and I did feel some sadness around that. And so those are both examples of real and perceived things. And again, what the future holds for all of us as far as the social norms are likely going to be very different. And the unknown is not only scary, but is an invitation for grief as well. So those are just some examples, and I'm sure others here can think of many others.
And a follow-up question from Joy, any suggestions for virtual support groups that these dementia family members could access?
I actually don't know of any specific ones. Others on this call might, though. Dr. Joe or Dr. Fall or Dr. Furman. I know the Alzheimer's Association may have, but I haven't looked recently to see what online support options they have. Do others know? I'm sure they exist. I don't readily have them at my fingertips.
And Barbara Gordon chimed in that every Monday night there's a virtual support group called My Health Matters. And then there's caregiver support groups that occur on Wednesday. That's another resource, good resource, and also mindfulness sessions. This can all be found on the Traeger Institute website.
Mm-hmm. Great, thank you.
Are there any more questions?
Mm-hmm.
I see a comment. Oh, it just disappeared out of my view about the Jewish family.
Yeah, it says
Jewish Family and Career Services have some things going on.
Okay, so you want to check their website out as well.
Yeah. Anyone else with any questions for our presenter or for Dr. Furman? Oh, and then Erica said caregiver resources at Traeger. Yeah, so not only do we have the support groups that occur on Wednesdays, we have a lot of caregiver resources available at our institute. And there we see in the chat the caregiver support group are every Tuesday from 12 to 1. And there's a link, and you can also get that on our website.
Yeah, when I was preparing this talk.
All our line, I'm sorry. Go ahead.
Okay. I was just going to say, when I was preparing this talk, the first thing I did was go to the Traeger Institute website. It was very impressive how many resources are available there. So that's a good place to start.
And Dr. Schappmeyer, just to follow up, I think the big part, it's just so hard when people are dying and not being able to be there. The hospital is pretty strict, I think, about like no visitors, but a lot of the nursing homes and the assisted living and personal care, each of them kind of have a different policy, and they are making exceptions for end of life care. So, it's really sad, but that kind of goes into the calculation of, do you want to send your loved one to the hospital or not? Now what some people are calculating is like, I can't be there with them if I send them to the hospital, you know, which makes it even the decision making even harder. And so, you know, what I have found is some of our patients at the nursing home are deciding to stay at the nursing home because they know that their family members can come if they're end of life, you know, to the nursing home, which is just, it's just awful that you're having to make those kind of decisions, you know, so that's a grief right there. But, and so I think people are kind of making these advanced care planning decisions like during COVID times, which then might change, you know, after COVID. But I will say that the healthcare team in the hospital, I think, are doing a remarkable job of, you know, I don't really think people are dying alone. You know, I think the nurses are there, the doctors are there, the providers are there. So that's some comfort.
This is Mona, and I would say there's a group that we may not think of, but probably should, and either text or call ever so often, and that's that extrovert that is just really needing people right now, and they need that hug. And I know I've got a few of my friends that way, and some may say I'm that way, but you know, we've been really very careful to keep in close contact.
Great points.
You know, what I've
that
seen
is actually very true. We were just to a group of friends last night about the need for hugs, and that is definitely a loss, is that you don't get that personal touch.
Right. The thing that really hit home for me about 2 weeks into our online teaching that we're doing here at the university, when I was having a meeting with my students, was, and I told my colleagues in this group about it at a meeting the next morning, was when a student told me that she realized that she hadn't been touched by another human being in 3 weeks. And that just really slammed home for me, made another loss really real. So even when you're connecting virtually, I know it is not the same as the physical connection that you miss, especially if you're isolated. And it's really important to just acknowledge that, name it.
Yeah, and that makes me really think about all the people in the nursing homes, how they are really struggling. They don't get any touch right now. It must be very, very hard, and they're very isolated. Oh, yes. And Barbara saying, parents of children who are graduating this year from 8th grade, from high school, from undergraduate and graduate colleges. Yes, there's a lot of sadness there. There's no ability to celebrate, no ability to have joy together with people. We should also think about young mothers who are delivering babies during this time. It's really difficult. It's very stressful for them.
Absolutely. And just remember, you know, that it's redefining the way we celebrate. Now, certainly a high school graduation, or my own son is graduating from 8th grade. The physical reality of that ceremony is not going to be, and for many of us who are experiencing graduations, but there are ways to recreate similar celebrations when this crisis is over, and just to really acknowledge that there will be opportunity when this crisis changes for us to honor these important rituals. But the things that require immediate physical connection are going to require some reframing of from physical to virtual as much as possible.
And since we're naming things, I think we can add to the list. Today was our Optimal Aging Conference that is not happening right now. That's where we were all going to be at our Optimal Aging Conference. So it's been, you know, rescheduled for June, which is great, but it is a loss, you know.
Absolutely.
You're right. Okay, any other questions, any other comments anyone wants to make about this?
Someone posted,
yeah.
SJax12 said, the following info on the caregiver support group via Jewish Family Services. Are you caring for an older adult? Join others, mutual support problem solving. It's facilitated by a social worker. And there's a phone number to call in the chat section. If you have your chat open, you can see it. But the phone number is Jessica at 502-452-6341. That's 452-6341. And the extension is 153.
And Joanne, I see this, that, patients are being discharged to family members because the facilities won't let them back in. We're getting calls from families who don't know what to do. Yeah, this is a big issue. And this is the long-term care task force address this, because some facilities have all these really, really intricate rules, which they don't necessarily have to have, but they're just afraid. But in Kentucky, there are COVID nursing homes opening, or COVID units in nursing homes opening. So Signature has one. I have to look it up here. Oh shoot, I just want to make sure I get this right. Summerfield is a Signature facility, and they do have a COVID unit. So the hospitals can discharge people. So like a person at Trayton Oak Towers that was positive went to Norton's. The Nortons discharged them to Summerfield, to the COVID unit. So that is an option for families. And if these families really can't take care of them, they should not take them home, because it's just, it's just bad. And so I think the families can push back and say, no, I'm not taking them home. That's what they've always been able to do in the past. Now, if it gets to be crazy and there's a lot of back and forth, that's what the health departments are for. And the big thing with these facilities too is some of them can't take them because they don't have the staffing, and because people are just not showing up for work. I mean, they have their own kids to take care of at home. They can't come to work, or they're scared, or they have COVID positive too, or they have symptoms. I mean, there's all kinds of things. The facilities are, a lot of them are short staffed. And so each local health department is able to help provide staffing. And that's one of the other things the task force is working on. There's a list of like 400 volunteers. Those are the medical students that went to Western Kentucky to help a facility. So they can send this group of volunteers to help these facilities. So I would tell the families, do not be bullied into taking them home, because it's not, if they can't do it before, I mean, what's changed because of COVID? Now they're magically a nurse and they can take care of their family at home. It's not true. So the hospitals, I think everybody was so worried, and it still is true that the hospitals are worried about this surge. But, elective surgeries are canceled and stuff. So they have more OR space. They have more pre-op space. So the hospitals can really handle a lot of these patients. So leave them in the hospital if the facility can't take them and the family can't take them. And then the health department will intervene and open up more facilities across the state. Summerfield is here in Louisville, but they have a facility. I forgot. Keith Knapp is the chair of this long-term care task force, and that's his big job. Is every day he's calling facilities to try to get them to open up COVID wings or COVID units. And he has gotten, I think there's about 3 throughout the state right now. But that's a big part what the task force is working on right now.
Good.
And hospice, that's what you said, Joanne, about hospice. Yeah, hospice is really able to step up, and hospice can provide 24-hour care at home. That's part of the Medicare benefit. And so they're willing to do that more than they used to because of this COVID crisis. So yeah, hospice is a great resource. And home health, yeah, it can really help. Yeah. And then Joanne, you put your Bluebird Home Care Joanne.Flatt@bluebirdhomecare.com on there too, because you all can help too. So yeah, I think it takes a village, right? It's like,
yeah,
absolutely does.
Yeah, we get calls from panicking families that don't, they can't take care of mom. So we go in there and work hand in hand with hospice, and we provide that bedside, 24/7. And hospice comes in and out, and we work with them, following all the proper procedures and cautions, and using all the proper techniques. And it's a little more complicated, but we work really well with hospice, and we always have. So it just works. We're able to help that way. We're able to help.
Yeah, and if you can do that, I've had that happen to some of my patients where they went to rehab for like a week when they usually would go for a month. but they just couldn't stand it. They really wanted their loved one home, you know, where they
Right.
could see them and touch them and stuff. So
Mhm.
yeah, getting the resources in there, you know, it takes a lot of pieces working together, but it can be done. And so that is another option is, what are the goals? And if the goals really are not to go back to the hospital and the goals are more comfort, consulting hospice is really, I've had patients do that more so during COVID than they would have done before, I think. And
Mhm.
it's been helpful.
Hospice just took care of both of my parents. Dr. Furman, you knew my mother-in-law. You were her physician.
Yeah.
They just passed. Bill died on the 2nd of March, and Virginia passed 6 days later on the 8th. They lived 68 years married, and they couldn't stand to be without each other. But we were
Wow.
able to keep them at home until their very last breath, both of them, because of the excellent care between caregivers and hospice.
Oh, thank you for letting me know that. I'm so sad, and I've expressed my condolences. I know. I mean,
Well,
but
she
that's
loved you.
amazing to be.
Yeah, she
But
loved
to
you.
be able to be at home, I mean, together, that says a lot. And not every family can do it, but you all did a great job to be able to make that happen.
We had matching hospital beds in the master bedroom, and the paramedics, when they brought her home from hospice, because she did a 1 week at the respite between the hospital and coming home so we could get everything in place. And the paramedics walked in and were like, wow, this is the best set up master bedroom for paramedics to work in ever. But I was a medic for 10 years, so I had the inside scoop there. So, but she really adored you and loved coming to see you. And we were glad that with hospice help, we were able to keep both of them at home.
Yeah. Oh, thank you for that feedback and those kind words. Yeah, you don't ever know sometimes what happens at the end. So thank you. And then Barbara said, Barbara Gordon, immigrant population is being impacted significantly in many communities, including Louisville, needs special attention. They don't always have access to the typical resources.
Mm-hmm.
Yeah, that's a big
Yes.
issue.
Absolutely.
And I think it's a lot of underserved communities. I think that's what, the governor has been saying. I don't know, he was going to act like they were going to put something out maybe today or something, because, he was like, there's hundreds of years of, not access to the healthcare system. We're not going to fix it all right now, but we can do better. So if there's anything specific, Barbara, that you know of that we can do, let us know. But, and Joy, you wanted to share the names of the facilities that are COVID. It's Summerfield. I'll type it in there too. It's Summerfield is the COVID, and Dr. Bobber is the medical director for that facility. And I don't think the whole facility is a COVID facility. I think there's a wing. And they're open. They just started. And also, I should say that Norton's Healthcare has helped. Let me just write this. Norton Healthcare now has an 800 number for long-term care, post-acute, long-term care, personal care, assisted living facilities to call if they have questions throughout the state. So they're going to be rolling out that number today too. I didn't hear about Hill Creek, but it could be. It could be
Yes.
that Hill Creek is.
Hill Creek is also, yes.
Oh, good. Okay.
Yeah, I got an email from them. They just recently purchased that property and they have it up and running. I believe I don't know if they're open right this minute, but if they're not, they're going to be open very quickly.
Okay, that's good to know, because I think,
Okay. All right. Well, thanks everyone. It's 5:53. I just want to announce, 10:53, I'm sorry. I just want to say that if you have any thoughts or anything to present or any topic you want us to discuss or any questions you have, feel free to send us an email at tragerinstitute@louisville.edu, with Traeger Institute being one word. And then we will work out a way that we can address it during this 1 hour session. And then another exciting announcement I want to make is that we're working very closely with the governor's office, and either he or his representative will most probably visit us soon on this 1 hour session. So keep your eye open for any announcement on social media and our weekly sessions that we send out for some information on that. But please let us know if you would like for us to address any issues you may have. And I am putting in the I am putting in the email address that you can use in the chat.
And
so with that, We are, I think, yes.
I just want to say that I know everybody, it can be depressing and it can be overwhelming, but we are going to get through this together. Everybody's done an amazing job of flattening the curve. Everybody's following the advice of the governor and the scientists. And so I think just keep up the good work, stay 6 feet apart, wash your hands, and yeah, we're going to get through it together.
Absolutely.
Yes, we definitely will. And thank you everyone for being with us on this call today, and please keep safe and stay 6 feet apart. Thanks everyone.
No hugging. Thank you. Have a great day.
Bye-bye.
Bye-bye.
Bye-bye.